First, let's talk about Menieres disease. This will present with a triad of tinnitus, hearing loss, and vertigo. The hearing loss that they'll have is sensory neural hearing loss, and Menieres occurs because the patients are producing too much endolymph in their ear. So they'll feel like a fullness in their ear as well. Next, let's talk about BPPV. This is when patients will have vertigo with sudden changes in their head movement. So for example, if you're turning over in bed in the middle of the night, patients will complain that they get really dizzy, or if they quickly turn their head a certain way, then they can also experience the vertigo. This happens because there's little calcium debris in the semicircular canals in the ear that are quickly shifting, and that's what causes the vertigo. So people with BPPV won't experience any tinnitus and they won't have any hearing loss, and they might have nausea and vomiting though, so you can give them promethazine to control for those symptoms. Next, we have auricular hematoma, or sometimes it's also called a cauliflower ear. This happens after a patient experiences trauma to the ear. So treatment for this is immediate incision and drainage to get that blood out, and also pressure dressing to prevent reaccumulation of blood. If you don't do an IND quickly, then they are at risk of developing an abscess or having avascular necrosis of the outer ear. Next, we have perilymphatic fistula. This can occur after head injury or barotrauma, for example, and they'll have leakage from the semicircular canals. These patients will complain of episodic vertigo that are triggered by pressure changes in their head that are caused by sneezing or straining. Loud noises can also trigger this, and these patients can also develop progressive sensory neural hearing loss. Patients who are in an airplane can also experience barotrauma of the tympanic membrane, which will look like a ruptured tympanic membrane, and that sounds really scary, like you'd have to do surgery on it or take immediate action, but actually it'll heal spontaneously, so you don't have to do anything about it, but it will take a couple weeks to heal. And if you have an upper respiratory illness before flying, that can actually increase your chances of getting barotrauma because the pressure differences will be greater. A eustachian tube dysfunction will occur when you feel that popping sensation in your ear, and patients can also complain of tinnitus and have conductive hearing loss. When you look in the ear for these patients, you're going to see a retracted tympanic membrane, and sometimes you can also see blood vessels around the tympanic membrane.